My sport teacher thought I was faking an injury, so I ended up in surgery. When I was in 10th grade, I got stuck with Coach Brennan for PE, and everyone knew he was the worst. He had this reputation for being a former college athlete who never made it pro and took out his bitterness on students he thought weren't tough enough. There were stories about him making kids run laps until they threw up, forcing injured students to keep playing because he thought they were being soft. He'd been teaching at Lincoln High for almost 15 years, and every year there were complaints to the administration that went nowhere because he had tenure, and the principal seemed afraid to challenge him. My name is Natalie, and I'd always been pretty athletic. Played soccer outside of school since I was 6 years old and usually did well in PE classes. But Coach Brennan had it out for me from day one because during our first week, I'd questioned why we had to run in 95-degree heat without water breaks. He'd called me a complainer in front of the whole class and said real athletes pushed through discomfort. From that moment, he watched me differently, like he was waiting for me to prove I was weak so he could make an example of me. It made every PE class stressful because I knew any sign of struggle would confirm his opinion that I was soft and dramatic. My best friend Olivia had PE the period before mine with a different teacher, and she'd tell me stories about how reasonable and supportive her teacher was, and I'd feel jealous because I was stuck with someone who seemed to actively dislike teenagers. My parents knew I was unhappy with the class, and my dad had even considered calling the school to request a transfer to a different section, but I'd talked him out of it because I didn't want Coach Brennan to think I couldn't handle his class. That pride would end up costing me significantly. We were doing a basketball unit in early November, right before Thanksgiving break, and I actually liked basketball even though I wasn't great at it. Coach Brennan had us doing these aggressive drills where we'd drive to the basket and other students would try to block us. Full contact allowed even though the school's official PE curriculum said contact sports were supposed to be modified for safety. He called it preparing us for real competition, said high school sports were soft compared to when he played. On a Thursday morning, the gym was packed with our entire class of 32 students, everyone sweating and tired from the previous drills. I was driving toward the basket during a scrimmage when another girl, Kiara, came in from the side to block me. She was one of the taller students and played varsity basketball, so when she moved to defend, she came in hard and fast. Her knee collided with the outside of my left knee at full speed, and I went down hard on the gym floor. The pain was immediate and intense, shooting up my leg in a way I'd never felt before. It wasn't like the typical bumps and bruises from sports. This was sharp and wrong and deep inside my knee joint. I tried to stand up, but my knee buckled completely and I fell again, catching myself with my hands. Several students gathered around asking if I was okay, and I told them through gritted teeth that I thought something was really wrong, that my knee felt like it wasn't connected properly anymore. I could feel something loose and unstable inside the joint, and when I looked down, it was already starting to swell. Coach Brennan pushed through the crowd and looked down at me with this expression like he was annoyed, not concerned. His arms were crossed, and he had that look on his face that I'd seen before when other students complained about injuries or exhaustion. He asked what happened, and I explained about the collision with Kiara, said my knee felt unstable and hurt badly, that I couldn't put weight on it at all. He told me to walk it off and get back in the game, that a little contact was part of basketball and I needed to toughen up. I tried to explain that I literally couldn't stand, that something felt torn or broken inside my knee, but he cut me off and said he'd seen this act before from students trying to get out of class. He said if I couldn't handle contact sports, maybe I should ask for a doctor's note to sit out permanently. The way he said it made it clear he thought I was faking to avoid participating, and several students were watching to see what would happen. I felt humiliated and angry, but also genuinely scared because the pain was getting worse, not better, and the swelling was visibly increasing. I tried to stand again using the wall for support, and when I put the smallest amount of weight on my left leg, my knee gave out completely, and I collapsed back to the floor. The joint felt like it was moving in directions it shouldn't be able to move, like the bones weren't properly connected anymore. Coach Brennan sighed loudly and told two students, Devin and Marcus, to help me to the bleachers where I could sit until I was ready to stop being dramatic. They practically carried me there because I couldn't walk at all, my left leg just dragging uselessly as they supported me on both sides. I sat on those bleachers for the rest of class with my knee swelling visibly, the pain throbbing with every heartbeat. Within 10 minutes, my knee had swollen to the point where I couldn't see my kneecap anymore, and it was turning dark purple and red. I asked Coach Brennan again if I could go to the nurse, and he said no, that I needed to stay and watch the class to learn proper technique since I clearly didn't understand how to play through contact. Several of my classmates kept glancing over at me with worried expressions, and Kiara came over during a water break to apologize, saying she hadn't meant to hit me that hard. I told her it wasn't her fault, that accidents happen in sports, but I was genuinely concerned about my knee because I'd never had an injury that felt like this before. By the time class ended 40 minutes after the initial injury, my knee had swollen to almost twice its normal size and had turned dark purple spreading down toward my shin. I couldn't bend it at all, and the pain was so intense I felt nauseous and lightheaded. My friend Devin stayed behind to help me and offered to carry my backpack, and together we hobbled toward my next class, which was AP Chemistry on the second floor. Every step was agony, and I had to pause multiple times to rest because the pain was overwhelming. My chemistry teacher, Miss Liu, took one look at my leg when I finally made it to class and her eyes went wide. She immediately wrote me a pass to the nurse and told Devin to help me get there, saying this looked extremely serious and shouldn't have been left untreated. The nurse's office was on the first floor, so we had to go back down the stairs, which took almost 10 minutes because I could only move one step at a time. The school nurse, Mrs. Kapoor, had been working at Lincoln High for over 20 years and had seen countless sports injuries. When she examined my knee, her expression went from concerned to alarmed. She asked what happened, and when I explained about PE class and Coach Brennan refusing to let me come to her office, her mouth formed a tight line and she said something under her breath that sounded like disapproval. She gently touched my knee in several places, checking for stability and range of motion, and each touch made me wince. She said this looked like significant ligament damage, possibly an ACL or MCL tear based on the swelling and instability, and I needed to go to urgent care or the emergency room immediately. She asked if I could call my parents, and I used the office phone to call my mom, who worked as a paralegal at a law firm downtown. When I explained what happened, my mom's voice went from worried to furious within seconds. She said she was leaving work right away and would be there in 20 minutes, and I should stay off the knee completely until she arrived. Mrs. Kapoor filled out an incident report documenting the injury, the timeline, and Coach Brennan's refusal to allow me to seek medical attention. She said she'd be submitting this to the principal immediately. My mom arrived in exactly 18 minutes, and I could see she was angry from the way she walked into the nurse's office. Mrs. Kapoor explained the situation and showed her the incident report, and my mom's face got red as she read it. She asked Mrs. Kapoor if this kind of thing happened often with Coach Brennan, and the nurse hesitated before saying she couldn't discuss other students. But this wasn't the first time she'd seen injuries from his class that should have been treated sooner. My mom thanked her and said we were going directly to the ER, and she'd be dealing with the school afterward. In the car, my mom was on her phone calling my dad, who worked in construction, telling him to meet us at St. Mary's Hospital. She was also leaving a voicemail for the principal, Dr. Ashford, demanding a meeting to discuss what had happened. I sat in the passenger seat with my leg elevated on the dashboard, ice pack from the nurse's office wrapped around my knee, feeling scared about how bad this injury might be. I played club soccer year-round and had a tournament coming up in 2 weeks that I'd been training for all season. The thought of missing it made me almost as upset as the pain. At the hospital, they took me back quickly once the triage nurse saw my knee. A young ER doctor named Dr. Mitchell examined me and ordered x-rays immediately to rule out fractures. The x-ray technician had to position my leg carefully because I couldn't straighten it fully, and even the gentle movements required for imaging made me grit my teeth. My dad arrived while I was in x-ray and met us back in the exam room, and my mom filled him in on everything that had happened. My dad, who was normally calm and measured, looked furious when he heard that Coach Brennan had made me sit on bleachers for 40 minutes with a severely injured knee. The x-rays came back showing no fractures, which Dr. Mitchell said was good news, but he was very concerned about the soft tissue damage. He said the swelling and instability strongly suggested ligament tears, and I needed an MRI as soon as possible to determine the extent of damage. He scheduled an MRI for the next morning at an imaging center associated with the hospital, and in the meantime, he fitted me with a knee immobilizer brace and gave me crutches. He prescribed pain medication and said to keep the knee elevated and iced, absolutely no weight bearing until after the MRI results came back. That night at home was miserable. The pain medication helped somewhat, but my knee throbbed constantly, and I couldn't find a comfortable position to sleep. I kept thinking about Coach Brennan's face when he'd dismissed my injury, the way he'd been so certain I was faking, and anger mixed with the pain and fear. My parents were up late talking in hushed voices in the kitchen, and I heard my mom on the phone with someone, probably a lawyer based on the terminology she was using. The next morning, we went to the imaging center for the MRI, which took about 45 minutes. The technician said the orthopedic surgeon would review the images, and we should hear back by end of day with results. We went home and waited, my knee propped up on pillows, ice packs rotated every 20 minutes. My mom had taken the day off work and was constantly checking her phone for the call. My club soccer coach, Vanessa, had texted asking what happened after hearing I'd been injured at school, and I sent her a brief explanation. She responded immediately saying not to worry about the tournament, that my health was the only priority, but I knew missing it would impact my standing on the team. The call came at 3:30 p.m. from Dr. Patel, an orthopedic surgeon who specialized in sports medicine. He asked us to come to his office immediately to discuss the MRI results, which made my stomach drop, because if it was good news, he would have just told us over the phone. We drove to his office in tense silence, and Dr. Patel met us in a consultation room with the MRI images displayed on a large monitor. He pointed to various areas of my knee as he explained the damage, and even to my untrained eye, I could see that something was very wrong. He said I'd completely torn my ACL, the anterior cruciate ligament that stabilizes the knee joint. I'd also partially torn my MCL, the medial collateral ligament on the inside of the knee, and there was significant damage to my meniscus, the cartilage that cushions the knee joint. He said it was actually one of the more severe knee injuries he'd seen in a teenage athlete, and without surgical intervention, my knee would remain unstable, and I'd likely develop early arthritis. Even with surgery, I was looking at 6 to 9 months of intensive rehabilitation before I could return to competitive sports. My mom asked what would have happened if I'd received immediate treatment instead of sitting on bleachers for 40 minutes, and Dr. Patel chose his words carefully. He said the delay in treatment had definitely made the swelling worse, and attempting to walk on the damaged knee multiple times had likely caused the partial MCL tear to worsen and had contributed to the meniscus damage. He couldn't say definitively that immediate treatment would have prevented surgery because the initial ACL tear was severe enough to require reconstruction regardless, but the additional damage to the MCL and meniscus might have been preventable with immediate immobilization and proper care. My dad asked about the surgery, and Dr. Patel explained that he'd perform an ACL reconstruction using a graft from my hamstring tendon, repair the MCL, and trim the damaged portions of the meniscus. The surgery would take about 3 hours, and I'd need to stay overnight in the hospital. He said the sooner we could schedule it, the better, because waiting too long would allow more scar tissue to form and could complicate the reconstruction. We scheduled the surgery for the following Monday, 5 days away, giving me a weekend to prepare mentally and physically. My mom asked Dr. Patel if he'd be willing to provide a detailed medical report documenting the injury, the timeline, and his professional opinion on how the delay in treatment had affected the outcome. He agreed without hesitation, saying he'd seen too many cases where coaches or teachers dismissed serious injuries, and he was happy to provide documentation for any legal proceedings we might pursue. That confirmation seemed to solidify something for my parents, and on the drive home, my mom said they'd be contacting a lawyer who specialized in school liability cases. My dad agreed, saying Coach Brennan needed to face consequences for what he'd done, not just to me, but to prevent him from doing this to other students. That weekend was a blur of pre-surgery preparation. I had to go in for preoperative testing, blood work, and medical history, meeting with the anesthesiologist, reviewing post-surgical care instructions. My parents were researching lawyers and documenting everything, taking photos of my swollen knee, getting copies of all my medical records, writing a detailed timeline of events. My friends came over to visit and signed my knee immobilizer brace with get well messages. Olivia brought me magazines and snacks, and we watched movies to try to take my mind off the upcoming surgery. My club soccer teammates sent a group video message wishing me luck and saying they'd miss me at the tournament. The support was touching, but also made me feel the weight of what I was losing. The season I'd worked so hard for now completely disrupted. Monday morning arrived too quickly. We had to be at the hospital at 6 a.m. for an 8 a.m. surgery time. The pre-op area was cold and clinical, and I changed into a hospital gown and got an IV started. Dr. Patel came by to review the surgical plan one more time and mark the correct knee with a surgical marker, a safety protocol to prevent wrong site surgery. The anesthesiologist explained what to expect, and then it was time. My parents hugged me and said they loved me, and I was wheeled into the operating room. The last thing I remember was the anesthesiologist telling me to count backwards from 10, and I think I made it to 7 before everything went dark. When I woke up in the recovery room, the first thing I noticed was that the sharp pain in my knee had been replaced by a deep, aching throb. My entire leg was wrapped in thick bandages and immobilized in a brace that went from my ankle to my upper thigh. A recovery nurse was checking my vital signs, and she told me the surgery had gone well, and Dr. Patel would be in to talk to me soon. My mouth was incredibly dry, and she gave me ice chips to suck on since I couldn't drink yet. My parents came in once I was more alert, and my mom had been crying based on her red eyes. She held my hand and said she was so glad I was okay, that the surgery was over. Dr. Patel visited about an hour later and said the reconstruction had gone exactly as planned. The ACL graft was secure, the MCL repair looked good, and he'd trimmed the damaged meniscus tissue. He said I'd done well under anesthesia and everything had proceeded without complications. I'd need to stay overnight for monitoring and pain management, and tomorrow I'd get instructions for home care and the start of physical therapy. The rest of that day was hazy from pain medication. I drifted in and out of sleep, waking periodically when nurses came to check on me or adjust my medication. My dad stayed overnight in a chair next to my bed while my mom went home to get some rest. I felt guilty about all the disruption and expense, but my dad said not to worry about any of that my health was all that mattered. The next morning, a physical therapist named Jerome came to teach me how to use crutches properly and navigate stairs, since we had stairs at home. Even with the surgical pain medication, putting any weight on my leg was excruciating, and I had to learn to let the crutches take all my weight while keeping my left leg completely off the ground. Jerome was patient and encouraging, saying it would get easier with practice, that the first few days were always the hardest. He showed my parents how to help me with transfers from bed to wheelchair to bathroom, and gave us a thick packet of exercises I'd be doing once I started formal physical therapy in 2 weeks. Dr. Patel discharged me with prescriptions for pain medication and anti-inflammatory drugs, strict instructions to keep the knee elevated and iced, and a follow-up appointment for 1 week to check on healing and remove some of the bandages. Getting home and settled was an ordeal. We had to set up a temporary bedroom on the first floor because I couldn't manage stairs yet, and my parents moved a twin bed from the guest room into the living room. My mom had bought extra pillows for elevation and a small cooler for ice packs. The first week after surgery was the worst week of my life up to that point. The pain was constant despite medication, and I couldn't do basic things without help. Showering required a special waterproof cast cover and a shower chair, and even then, I needed my mom's help to safely get in and out. Getting dressed was a challenge because I couldn't bend my knee at all. Sleeping was difficult because I couldn't find a comfortable position, and if I accidentally moved my leg during sleep, the pain would wake me immediately. My friends texted and visited when they could, but I felt isolated and depressed, watching from the sidelines as life continued without me. The club soccer tournament happened that weekend, and Vanessa sent me updates and photos, trying to include me even though I couldn't be there. The team won their division, and I felt simultaneously happy for them and devastated that I hadn't been part of it. On Wednesday of that first week, my mom met with a lawyer named Howard Feldman, who specialized in educational liability cases. She brought him all our documentation, the medical records, the incident report from the school nurse, Dr. Patel's detailed report about how delayed treatment had worsened my injuries. Mr. Feldman reviewed everything and said we had a very strong case for negligence. Coach Brennan had a legal duty of care as a teacher, had been presented with clear signs of serious injury, and had not only refused proper medical assessment, but had forced me to remain in his class rather than seeking help. The school district could be held liable for his actions, and we could seek damages for medical expenses, pain and suffering, and potentially future impacts on my athletic career and scholarship opportunities. He said cases like this often settled before trial, because school districts didn't want the publicity of a teacher ignoring a student's serious medical emergency. He agreed to take our case on contingency, meaning he'd only get paid if we won or settled, taking a percentage of any award. My mom signed the representation agreement, and Mr. Feldman said he'd start by sending a formal demand letter to the school district outlining their liability and our damages. My mom had also filed a formal complaint with the school district's administration demanding a meeting with the superintendent, not just the principal. That meeting was scheduled for 2 weeks out, after I'd had my follow-up with Dr. Patel. My dad used that week to collect statements from students who'd been in class the day of my injury. Devin wrote a detailed account of what he'd witnessed, including Coach Brennan's dismissive attitude and refusal to let me go to the nurse. Kiara wrote a statement explaining the collision and how she'd immediately known something was seriously wrong based on how I'd fallen and couldn't get up. 3 other classmates provided statements describing Coach Brennan's general pattern of dismissing injuries and forcing students to continue participating even when they were clearly hurt. One student, a girl named Priya, wrote about how he'd made her continue running last year even after she'd twisted her ankle, and she'd ended up with a severe sprain that had taken months to heal. The pattern that emerged from these statements was damning, showing that my case wasn't an isolated incident but part of Coach Brennan's systematic disregard for student safety. The 1-week follow-up with Dr. Patel went well. He removed the outer bandages and examined the surgical incisions, saying they were healing nicely without signs of infection. He cleared me to start gentle range of motion exercises at home, basic movements to prevent stiffness, though I still couldn't bear weight on the leg. He said I'd start formal physical therapy the following week, and that would be the beginning of the long road to recovery. My mom asked how long until I could return to soccer, and Dr. Patel was honest that it would be at least 8 to 9 months before I could return to full competitive play, possibly longer depending on how well I responded to rehab. He said some patients recovered faster, some slower, and there was no way to predict exactly how my body would heal. Hearing 9 months felt devastating, like forever when you're 16 years old and your sport is a huge part of your identity. The meeting with the school district happened on a Friday afternoon in early December. My parents, Mr. Feldman, and I went to the district administration building and met with Superintendent Walsh, Principal Dr. Ashford, the district's legal counsel, and the head of human resources. I was still on crutches and wearing my knee brace, a visible reminder of the injuries we were discussing. Mr. Feldman presented our case methodically, walking through the timeline, the medical evidence, the statements from witnesses, and Dr. Patel's expert opinion. He emphasized that Coach Brennan's negligence had directly resulted in worsened injuries that would impact my life for years to come, potentially affecting my ability to play soccer at the college level and costing me scholarship opportunities. The district's lawyer tried to argue that sports injuries were inherently risky and that Coach Brennan had used his professional judgment in assessing the situation. Mr. Feldman countered by pointing out that a reasonable person would have recognized the severity of my injury based on the immediate swelling, my inability to bear weight, and my consistent reports of serious pain. He said forcing a student with a visibly severe injury to sit on bleachers for 40 minutes instead of sending them to the school nurse wasn't professional judgment, it was negligence bordering on reckless endangerment. Superintendent Walsh asked if we'd be willing to settle this matter without litigation, and my mom said that depended on 2 things: appropriate compensation for damages and assurance that Coach Brennan would never teach again in this district. The superintendent and lawyer exchanged looks, and Walsh said they'd need time to investigate and consider our demands. He promised a response within 2 weeks. Principal Dr. Ashford, who'd been mostly quiet, finally spoke up and said he wanted to personally apologize for what had happened, that student safety should always be the first priority, and clearly that standard hadn't been met in this case. We left that meeting without resolution, but with the sense that the district was taking this seriously and would likely settle rather than go to trial. Physical therapy started the following week with Jerome, the same therapist who'd taught me to use crutches in the hospital. His clinic specialized in sports rehabilitation, and the space was filled with other athletes recovering from various injuries. My first session was an assessment where Jerome evaluated my range of motion, strength, and pain levels. He said my knee was very stiff, which was expected this early after surgery, and we'd start with gentle exercises to begin restoring flexibility. Those gentle exercises were excruciating. Simple movements like trying to bend my knee even 5 degrees while lying down made me break out in sweat. Jerome was encouraging but firm, saying I needed to push through the discomfort, that the only way to regain mobility was to consistently work the joint even when it hurt. We did exercises 3 times a week for the first month, gradually increasing the intensity as my knee healed. By January, I could bend my knee to about 90 degrees and could bear some weight with the brace on. Progress felt achingly slow. The school district's response came in mid-January. Their lawyer called Mr. Feldman with a settlement offer. They'd pay $125,000 in damages, cover all medical expenses past and future related to the knee injury, and guarantee that Coach Brennan would not return to teaching in the district. In exchange, we'd sign a settlement agreement and non-disclosure clause preventing us from publicly discussing the specific terms. Mr. Feldman reviewed the offer with us and said it was actually quite generous, reflecting how concerned they were about the case going to trial. The medical coverage was particularly important because it would pay for ongoing physical therapy, any additional surgeries if needed, and long-term care related to the injury. My parents asked what I thought, whether the money and Coach Brennan's removal were enough justice for what happened. I thought about it carefully and said yes. I mostly wanted to make sure he couldn't do this to another student, and if he was being permanently removed from teaching, that goal was accomplished. The money would help with medical bills and could go toward college expenses. Fighting this in court would take years and force me to relive the trauma over and over. I was ready to move forward with my life. We accepted the settlement in February. The money was placed in a structured settlement with part going to a trust for my college education, and part available immediately for ongoing medical expenses. Coach Brennan officially resigned from Lincoln High School effective immediately, and rumor had it he'd been given the choice to resign or be terminated and had chosen resignation to avoid having a termination on his record. The story spread through school quickly, and reactions were mixed. Some students thought he'd been treated too harshly, that he'd made an honest mistake and was being scapegoated. Others, particularly those who'd been in my PE class or had their own negative experiences with him, felt he'd finally faced consequences for years of problematic behavior. Several former students reached out to my parents sharing their own stories of Coach Brennan dismissing injuries or forcing them to participate when they were hurt. One story particularly stuck with me. A boy named Leo described how Coach Brennan had made him finish a cross-country run 2 years ago, even after Leo said he was having chest pains. Leo had collapsed at the finish line and been rushed to the hospital where they discovered he had an undiagnosed heart condition that could have killed him if he'd pushed any harder. The fact that there were multiple students with similar stories made it clear that my case wasn't a one-time error in judgment, but a pattern of dangerous behavior. Physical therapy continued through winter and spring. By March, I was walking without crutches, though I still wore a brace for stability. By April, I could do most normal activities, including climbing stairs, though running was still difficult and painful. Jerome said I was progressing well compared to typical ACL recovery timelines, that my youth and previous athletic conditioning were helping my body heal. We started incorporating more challenging exercises, single-leg balance work, resistance training, plyometric movements that would eventually prepare me to return to soccer. Each milestone felt like a victory. The first time I could jog without pain, the first time I could jump and land on my left leg, the first time I completed a full training session without my knee swelling afterward. But there were also setbacks. Days where my knee would randomly give out and I'd almost fall. Times when the pain would flare up for no obvious reason and I'd have to ice it and rest. The mental aspect of recovery was harder than the physical in many ways. I'd lost confidence in my knee and was afraid of re-injury every time I tried something challenging. Jerome said that was completely normal, and that rebuilding trust in your own body after a major injury takes time and patience. My club soccer coach, Vanessa, had stayed in touch throughout my recovery, sending encouraging messages and making it clear my position would be waiting when I was medically cleared. That support meant everything to me, knowing I hadn't been forgotten or replaced while I was injured. In June, 7 months after the initial injury, Dr. Patel cleared me to begin light soccer practice with no contact. I could do passing drills and light running, but no scrimmages or games yet. Stepping back onto a soccer field for the first time felt emotional. I'd missed this so much. The feel of grass under my cleats, the rhythm of kicking a ball, the camaraderie with teammates. My first practice back was nerve-wracking because I was hyper-aware of every movement my knee made, constantly worried it would give out or that someone would accidentally collide with me. But nothing bad happened. I completed the practice tired but happy, and Vanessa pulled me aside afterward to say how good it was to have me back. She said to take my time and not rush anything, that my health was more important than any game or tournament. Over the summer, I gradually increased my training intensity, working closely with both Jerome and Vanessa to ensure I wasn't pushing too hard too fast. By August, 9 months post-surgery, Dr. Patel cleared me for full contact practice. I did my first scrimmage since the injury and made it through without incident, though my knee was sore afterward. Vanessa carefully monitored my playing time, never letting me do full 90-minute games, gradually building up my endurance and confidence. In September, I played my first competitive game back. We won 3-1, and I scored a goal that made me cry with happiness and relief. My teammates surrounded me celebrating, and I saw my parents in the stands crying too. That moment felt like redemption, proof that I'd survived this awful injury and made it back to the sport I loved. The knee felt different than before. Not bad, but changed. Like I was more aware of it than I'd been previously. There was some lingering stiffness and occasional soreness after hard practices, but overall it functioned well. Jerome told me that was normal, that my knee would never be quite the same as before the injury, but it could still be strong and functional if I maintained my conditioning and remained aware of its limitations. When I went back to school for 11th grade, there was a different PE teacher, a younger woman named Ms. Talbot, who was completely different from Coach Brennan. She was encouraging and safety-focused, immediately asking about any injuries or limitations students had, making accommodations without judgment. The difference in atmosphere was remarkable. Students actually seemed to enjoy PE class instead of dreading it, and there were no more stories of people being forced to participate while injured. Some of my classmates asked what had happened to Coach Brennan, and I gave vague answers about him leaving the school, unable to share details because of the settlement agreement. But the basic story was known throughout the school, that he'd dismissed a serious injury and faced consequences. I hoped that knowledge would protect future students, that other teachers would see what happened and take student injuries more seriously. My junior year season went well despite the time I'd missed. I played consistently, scored several goals, and helped my club team finish second in our regional division. College scouts started showing interest, and I began the process of reaching out to college programs about potential recruitment. The injury became part of my story in those conversations. I was upfront about what had happened and my recovery process, and most coaches were impressed by my resilience and determination to return to competitive play. One coach from a Division II school said the injury had probably made me a better player in some ways, more mentally tough, more appreciative of the opportunity to play, more aware of my body and its capabilities. By senior year, I'd fully returned to my pre-injury level of play and was fielding interest from several colleges. I ended up accepting a partial scholarship to a Division II school with a strong soccer program and good pre-med track, because I'd decided during my recovery that I wanted to go into sports medicine. The injury experience had sparked an interest in helping other athletes recover and return to their sports. I wanted to be the kind of medical professional who took injuries seriously, who listened to patients when they said something was wrong, who understood from personal experience what recovery felt like. I took my first college-level anatomy course during my senior year of high school through a dual enrollment program, and I loved learning about how the body worked, particularly the biomechanics of joints and muscles. My knee became a case study I referenced often, understanding through my own experience how ligaments functioned and what happened when they were damaged. Graduation came in June, and at our ceremony, several teachers were recognized for years of service. Coach Brennan's absence was notable, and I wondered briefly where he'd ended up, whether he'd found another teaching job or left education entirely. Part of me hoped he'd learned something from what happened, that he'd changed his approach if he was still working with students. But mostly I tried not to think about him, to focus on my future rather than dwelling on the past. College started in August, and I played 4 years of soccer while completing my pre-med requirements. My knee held up well with proper conditioning and maintenance. I had one minor scare sophomore year when I twisted it during a game and thought I'd re-torn something, but it turned out to be just a minor sprain that healed with rest. That scare reminded me how fragile athletic careers can be, how one moment can change everything. I graduated with honors and applied to medical schools with a specific interest in orthopedic surgery and sports medicine. In my personal statement, I wrote about the injury and Coach Brennan's dismissal of it, how that experience had shaped my desire to become a physician who treated patients with empathy and respect, particularly young athletes who might be struggling to advocate for themselves with authority figures. I got accepted to several medical schools and chose one with a strong sports medicine program. I'm now in my second year of medical school, and I've done clinical rotations in orthopedics where I've seen countless knee injuries similar to mine. Each time I see a young athlete with an ACL tear, I think about my own experience and try to provide the kind of compassionate, thorough care I received from Dr. Patel. I tell them honestly what recovery will be like, that it's long and difficult but possible, that they'll come back from this. Many of them thank me for the honesty and encouragement, saying other doctors have been dismissive or didn't seem to understand what this injury meant for their athletic identity. I still play soccer recreationally, though not at the competitive level I maintained through college. My knee simply can't handle the stress of intense competition anymore, and I've made peace with that limitation. Some dreams change shape because of circumstances beyond our control, and learning to adapt is part of growing up. But I can still enjoy the sport casually, playing pickup games with friends, coaching youth soccer on weekends, staying connected to something that's been central to my life since childhood. Last year, I ran into Kiara at a coffee shop in our hometown. We'd lost touch after high school, both moving away for college. She immediately recognized me and came over, and we ended up talking for over an hour. She said she'd felt terrible about the injury for years, had carried guilt even though I'd told her at the time it wasn't her fault. I reassured her again that accidents happen in sports, that the real problem had been Coach Brennan's refusal to provide appropriate care after the collision. She seemed relieved to hear it again, and she told me she'd gone on to play college basketball and was now coaching at a high school in the area. She said my injury had actually changed how she approached coaching, that she was hypervigilant about student injuries and always erred on the side of caution, sending kids to trainers or doctors if there was any doubt. She said she never wanted to be responsible for dismissing something serious the way Coach Brennan had. We exchanged numbers and have stayed in touch since then, occasionally meeting for coffee to catch up. That reconnection felt important, like closing a loop that had been open for years. I'm 25 now, and my knee still bothers me sometimes, especially in cold weather or after long runs. It's a permanent reminder of that day in PE class, of how quickly life can change, of how important it is for people in positions of authority to take their responsibilities seriously. I think about Coach Brennan occasionally, wonder if he ever thinks about me, if he feels remorse for what happened. The settlement non-disclosure agreement prevents me from sharing specific details publicly, but the basic story is known, and I use it sometimes in advocacy work I do around student-athlete safety. I've given talks at coaching conferences about recognizing and responding appropriately to injuries, about the importance of believing students when they report pain or distress. The talks are always well received, and several coaches have told me afterward that my story changed how they approach their own practice. If even one student is protected because a coach heard my story and decided to take injuries more seriously, then maybe something good came from that terrible experience. The injury taught me about resilience and patience, about advocating for yourself when others dismiss your experience, about the importance of empathy in medical care. Those lessons have shaped who I am and how I approach my work in medicine. I share my story with patients when appropriate, letting them know I understand what they're going through because I've been there. Most appreciate hearing from someone who's experienced similar trauma and come out the other side. My parents are proud of how I've turned the experience into motivation for my career, though my mom still gets angry when the topic comes up, still feels that protective fury about how I was treated. My dad says he's glad the settlement money went toward my education, that at least something positive came from a terrible situation. The money did help significantly with medical school costs, along with scholarships and loans. I sometimes calculate how much that injury cost in total. The surgeries, the physical therapy, the lost opportunities, the ongoing maintenance, and I realize it's well into six figures when you account for everything. The settlement covered most of it, but there are intangible costs that can't be calculated. The trauma, the fear, the loss of innocence about trusting authority figures to keep you safe. I recently heard through mutual acquaintances that Coach Brennan left teaching entirely after the settlement, moved to a different state, and now works in commercial real estate. Part of me is glad he's no longer in a position to hurt students, but another part wishes he'd faced more significant consequences, that his teaching license had been permanently revoked, rather than him just choosing to leave the profession. But I've learned that justice doesn't always look the way we expect or want it to, that sometimes the best outcome is simply preventing future harm, even if past wrongs aren't fully addressed. My focus now is on the future, on becoming the kind of doctor I needed when I was injured, on contributing to a culture in athletics where injuries are taken seriously and students are believed when they report pain. The experience has made me a better advocate, a more empathetic caregiver, and hopefully will make me a better physician. If my story can help even one person, then the pain and struggle of that recovery will have served a purpose beyond just getting me back on the soccer field. And that's all I can really ask for at this point, that something meaningful came from something terrible, that I use the experience to grow rather than letting it diminish me. Appreciate you watching this far. If you enjoyed it, drop a like, leave a comment, and subscribe so you won't miss the next story.